RHR expert, Health Integration and East Africa Director, Women Lift, Karibu again, and Dr. Lorraine Mugambi Nyaboga, Chief of Party, USA TB ARC and Center for Health Solutions, Kenya. Now, while we were going on the break now, TB needs professionals to handle it. And as we speak right now, the country is going through a difficult time. Doctors are not in hospitals to take care of this. What effect does this have when it comes to provision of services to the patients who need this?
Dennis, this is something that is very serious because as we approach TB and trying to manage TB, the health system needs to work. And the health system needs its health workers to work. For a patient to come from whichever area, whichever county, presenting with cough, sweats, maybe thinking that they have TB and need to be checked, we'll present themselves to a facility, and there'll be no health worker in sight to screen, to diagnose, to treat, should it be TB or any other disease. So the health workforce is truly the backbone of the health system. If the health workforce is absent, we are missing out on TB and many other diseases and things that we need to manage. So this is a lost opportunity. The number of TB patients we are missing to screen, to diagnose, treat, and manage right now, there's definitely an impact for us having this health worker strike. And as soon as it is really resolved, would be the betterment for all Kenyans.
Mm-hmm. And Dr. Lorraine, even when we're talking about just how important are intern doctors in handling these patients?
I don't think I could have said it any better from what Dr. Nora has just mentioned. And the honest truth is that a health system has various building blocks, and the health workforce is right there in the middle of all that. Intern doctors, in addition to nurses, clinical officers, and various cadres within the health space, really do play a big role in being the first response whenever a patient visits that health facility. And so when they are missing in that particular health facility, then of course there's a significant risk that that patient will be missed out from screening, from diagnosis, and those who are being treated may not get the right medication to follow up and so forth. So I think this is a dark time for us in the health space, and we really do hope that this can be addressed as soon as possible.
And we really hope that, yes, indeed, it's going to be handled as soon as possible for the sake of patients and just the health system of our country. But now let's get back to handling TB. As women in this field, how significant is it for women to push this agenda? Because on a very simple day, if a child is sick, they more often than not go back to the mother to make sure that this is there. And as professionals in this space, how significant is that? They say women are compassionate.
And even more. And even more than it's. No, I mean, I can liken the situations just as the health workforce is a critical health system pillar. Same for the woman. The woman is critical for the whole community, for the whole society. She is indeed the backbone. And what I'm driving at here is that women are nurturers. They're the ones taking care of the household. They're the ones who will, take the child or a family member to the hospital to seek healthcare services. Unfortunately, in comparison to the men, health-seeking behavior is much slower, so they present much, much later. But the importance of this is that women are really the drivers. They will seek the care, they will take you to care, they will manage their households. But just, not looking at them just as users of the health system, they're also providers. A majority, in fact 70% of the health workforce globally are women, and the statistics are not any different here in Kenya or generally the global south. They are the women, however, they're not in leadership positions who will drive the policies and the decisions that we need to make the impact or even to move towards ending TB. So what I'm pulling at is that women across board, whether they're the utilizers of the health services, whether they're the providers of the health services, they're also there in the decision-making space. And women's leadership is different, and I think I'm calling to that, what you were saying, they're compassionate. Beyond that, even just as leaders, their leadership style is very different. They're very transformative in their thinking. They're inclusive. And as I was saying, the child, the husband, the grandma, they will all be included. They will also partner in terms of collaboration. They will look at which partner needs to come in here, which other stakeholder needs to come in here, and that is presented in leadership. And this is critical even as we move, towards ending the TB as we see it, because we have to have multi-sectoral approaches. We have to have collaborations across board, and so women bring this on board. And lastly is that they really look at the community good. They look beyond them. They look beyond even the household into societies. And so I think what I'm also just advocating for here is that women must be part and parcel of this delivery of TB and other health services, because when women lead, better health outcomes shall surely follow.
Now, Dr., when you talk about TB, there is a question of the screening that needs to happen, information that needs to get to the people, and just awareness around TB. In terms of the country, like we were speaking of the record earlier, I told you the story of my friend, and this is sad as we speak, because now we need to go through the whole system in a very difficult time. So how do we make sure that this information gets to the people and they understand it? That the government as well and all the stakeholders pull their weight in making sure that all of us are united in fighting TB?
Absolutely. And that's a good question, Dennis, because the honest truth is that it's just that many of us are not keen. But if you were to dig deep, you would find that most of us have had contact with at least one person who has been diagnosed with TB, or who has TB and it's undiagnosed, because Kenya, first of all, is a high prevalent country for tuberculosis. We rank among the top 30 countries that sort of contribute to 80% of the global burden for tuberculosis. So that's number one, the fact that we are a high burden country. What does this mean? It means that 1 out of every 3 Kenyans is actually infected with the bacterium that is responsible for tuberculosis.
We are 3.
Yes. Absolutely. 1 out of every 3 Kenyans is infected. It doesn't mean we have the disease. It just means we have the infection. So the next step then goes to, how do you then develop disease? And disease then develops when your immune response no longer is able to hold back that infection, and so that bacterium begins multiplying and starts causing signs and symptoms. The cough, the fever, the poor weight gain for children, the weight loss for adults, and night sweats as some of the symptoms, the common symptoms. Of course, there are others, like producing blood-stained sputum, being very weak, lethargy in children, and so forth. So those are some of the symptoms that are associated with tuberculosis. So what do we need to do to ensure that a lot more Kenyans are aware? The first thing is, of course, to share information that these are some of the signs and symptoms associated with tuberculosis. If you have been coughing for over a week, go to the health facility and ask for a TB test. Every public health facility is able to do this test for free. The Ministry of Health has partnered with various stakeholders in ensuring that testing services for tuberculosis are free of charge in every public health facility. So no one should say that I don't have the money to be tested for TB. So first is being aware of the symptoms. Number two, knowing that the testing services, that is some of the tests include Gene Expert, which I know we've talked about in the past. Sometimes we will do a chest x-ray for you and others. But it's important that Kenyans know that these testing services in public health facilities are free of charge. Then the next thing is, once one is diagnosed with tuberculosis, ensuring that they actually take their medication to the very end. If you have uncomplicated tuberculosis, treatment is for 6 months, and your health worker will work with you to ensure that you are able to take your drugs every day for the 6 months and you complete your treatment. So the other thing Kenyans must know is that this disease requires treatment for a long time, 6 months, and you must complete your treatment. Many times within the first month, you're already feeling better, and some people would stop taking their medication, and that's where the challenges come, because then the disease advances and starts causing complications. So it's important again to mention that once treatment has been initiated, you must complete treatment.
And I come to you, Dr. Now, when you talk about TB and the society out there and how it it consumes this information that so and so has TB, has made people not want to really come out and even go to hospital because of what the community will say, what my people will say. Therefore, how do we then pass this information such that people don't look at TB as the final tape for someone who has it?
Yeah, addressing the stigma and the discrimination that comes with it. And I think it's making TB part and parcel of conversation. And that's what Dr. Lorraine has spoken to in terms of ensuring that there's awareness, that we know that there's treatment. Because when you're not aware that there's treatment and there's, you'll 6 months, complete your treatment and it's resolved, then you'll naturally keep quiet with it. And it's the same thing with HIV. And they will run, side by side here, because you do not want to declare your status because of how you'll be treated, whether it's by family members or even sometimes the facilities. And so we must ensure that we are we're having zero tolerance for discrimination and stigma around HIV, TB, and all other illnesses. And now that there is treatment for it, truly it is curable. Then really we should just have it that we can have a positive test and we can get treatment. Treatment is available in the public health facilities. You can complete your treatment. We engage as well the household, and that's why we have the community programs. The community also surrounds you. We have the community health promoters that we saw the program launched just recently. These are the people who will also work with you and keep the conversation going within the community, and also just supporting you in the household, as well as the support you receive from the facility. And so even in our facilities, we do encourage zero discrimination and discourage stigma around it and treat it just like any other illness that needs to be treated. You'll have pneumonia, you will take your antibiotic for 7 days, it's resolved. TB is curable, so we really should just put a nail on the issue around stigma.
And Dr. Lorraine, as we close, I just want you to talk in terms of the international obligations, the promises, the agreements around TB, and the need to have all these agreements not just on paper, but that they are followed through to make sure that you're making positive strides.
So we have a global NTB strategy, which is a plan that is in alignment with the Sustainable Development Goals. And this plan is to end TB by 2030. And this is a plan that has been signed by all countries, particularly countries that are high burden for tuberculosis, such as Kenya, to put in place strategies to ensure that we are ensuring as much as possible those who need to have prevention, TB preventive therapy, are put on prevention, that we are finding the missing cases within communities and health services, so case finding, that we are ensuring those who are diagnosed complete treatment and that there are no complications from tuberculosis. This global strategy really, and especially for Kenya, by 2021, we had done pretty well as a country, and we were among very few countries that were able to report a 35% reduction in mortality, that is in deaths associated with TB, and also a reduction in the number of cases from tuberculosis. So Kenya, I feel, is on the path towards meeting the global targets as far as the 2030 NTB strategy targets are concerned.
That is Dr. Lorraine Mugambi Nyaboga, Chief of Party USAID TB ACT and the Center for Health Solutions in Kenya, and Dr. Nora Obudo, SHR expert, Health Integration and East Africa Director, Women Lift Health. Asanteni sana. And this conversation definitely must continue as we celebrate the TB Day. We shall be seeking your assistance on